malaria, tuberculosis, cholera, Ebola, Zika. These are the infectious diseases we most often hear about in the news. But there's one disease that is grossly overlooked, one that I bet most people have never even heard about. This disease is Chagas or trypanosomiasis. Trypanosomiasis is a parasite transmitted by blood-sucking bugs, which cause long-term damage to the heart and central nervous system. This disease is endemic to Latin America, with an estimated 8 million people infected, making it Latin America's most dangerous parasitic disease. The disease is also found here in the US, where about 300,000 to 1 million people are estimated to be infected with Chagas. This disease is transmitted by a parasite called Trypanosoma cruzi, carried by the red-ovide bugs. These bugs are nicknamed kissing bugs because they come out at night and bite their victims on the face, sucking their blood. However, the parasite is not actually transmitted through the bloodstream. The parasite is contained in the feces of the bugs, so they defecate on the victim's body and leave their infected wastes behind. This easily enters the body through the mouth, nose, eyes, or lacerations in the skin. From this point on, the person is infected with trypanosomiasis. Chagas has both an acute and chronic phase. The acute phase is usually nondescript in its symptoms, often mistaken for the common flu. Symptoms can be fever, headache, diarrhea, cough, muscle pain, and swelling at the infected site. After a few weeks to a few months, the disease can take two courses. It either enters a prolonged asymptomatic phase, or the person develops chronic symptoms, which happens in 20 to 30% of cases. Chronic symptoms include heart rhythm abnormalities, which can lead to a heart attack, a dilated heart, which can cause heart disease, or a dilated colon and esophagus, resulting in digestive problems. In its chronic phase, the Chagas parasite slowly moves its way into organ tissues and breaks them down, reducing their functionability. This process can take 10 to 20 years, so when a victim dies of heart disease, it can be hard to trace it back to Chagas. Diagnosing and treating Chagas proves to be a very difficult task. A microscopic examination of a blood smear is the most effective test used to visibly see the parasite and confirm it this way. However, this only works for the acute phase. Chronic Chagas is diagnosed based on analyzing the likelihood of infection combined with serologic testing. As for treating Chagas, there are only 2 medicines available, and they incur so many undesirable side effects that even their benefits are deemed questionable. These drugs, benzodiazole and nifurtimox, are not readily distributed to those with Chagas in South America, and they are not approved by the FDA. Instead, a more effective method of battling Chagas is to look at the modes of infection and focus on curtailing the spread of the disease. Focusing on the regions where Chagas is the worst, that being Mexico, Central America, and South America, 80 to 90% are infected with Chagas through contact with the feces of an infected triatomine bug. The next most common method of transmission is congenital, where the mother passes it to the baby. Food contamination, blood transfusions, organ transplants, and lab accidents are other methods of transmission. Latin America is especially prone to this disease because of the poor living conditions, unsafe food and water sources, and poor hygiene. Kissing bugs live and breed in the cracks and crevices of houses in Latin American communities. Since Chagas is difficult to treat, the best way to battle it is to prevent it. First and foremost, this can be done by educating people about this disease and how to prevent it from spreading. Dr. Patricia Dorn is taking what she calls an eco-health approach to solving Chagas by traveling to South America and helping people improve their houses. Using a budget of only $50 a house, Dr. Dorn works with local people to fill the cracks in their homes with volcanic ash and convert the dirt floors so that kissing bugs will not stay and breed. Overall, this disease is believed to be quite easy to prevent. By taking simple steps such as raising awareness and making basic home improvements, we can help reduce the threat of Chagas.